What are the pros and cons of general practice in the UK? I'm Dr. Arora from Arora Medical Education. I get asked this question a lot by international medical graduate doctors and doctors in the UK, in fact, when they're thinking about applying for specialty training. Do I apply for GP training or something else like psychiatry or core medical training or internal medical training or ONG or radiology or whatever else it might be? Often it is general practice versus something else. So I thought this video I can talk about some of the common pros and some of the common perceived cons that I always talk about when it comes to GP training. I am a portfolio GP. I'm now in full-time medical education, but I worked as a GP for a long time and I went through GP training. So I saw a lot of the pros that are very good for GP training, and I saw or hear about more often some of the perceived cons, and I'll try to weigh them up in this video to give you a little bit of a better idea about whether a career in general practice might be for you or not. So very briefly, what is general practice? We've got another video that goes into a bit more detail about this elsewhere on the channel, but what is general practice? Of course, in the UK, you have the primary care system or general practice and the secondary care or hospital system. So GP is anything that is in the primary care or community side of medicine in the UK. It is often known as the gateway to the NHS because the majority of doctor-patient contact or consultations in the UK around healthcare are done in the community, in primary care, in a general practice, and often a lot of referrals through to specialists happen through the general practice system. Now, GPs or general practitioners are also known as family physicians, are also known as consultants in community medicine or consultants in family medicine. There are various terms that I use for this umbrella of general practice. But let's talk about some of the pros and the cons if this is going through your mind right now. Pro number one, probably the biggest pro that we always hear about general practice is flexibility. There is very few careers in medicine other than general practice that give you the amount of flexibility that you can have as a GP. Flexibility in terms of what you see on a day-to-day basis, flexibility in terms of how you shape your career, flexibility in terms of how you shape your working week, flexibility in terms of the type of GP that you want to be. We'll break these down in a bit more detail as we go through more pros, but one of the biggest draws of general practice and one of the reasons why lots of doctors do think about this initially is the flexibility that you get in your career. And I'll talk about this in more detail as we go through some more pros. So leading on from that, pro number two is the range of medicine that you get to see. Now, there are very few specialties in the UK, or in fact globally, where you see the depth and the breadth of pathology and medicine that you might see in general practice. Now, I always remember a clinic of mine where I saw a 2-day-old baby, and the very next patient, I saw somebody who just had their 100th birthday. That is the breadth that you see in terms of the age range that you see. So you're seeing pediatrics right the way through to elderly care, but also breadth in pathology. You're seeing renal one patient, then psychiatry the next patient, then cardiology the next patient. There's so much that you're going to see. You have no idea what's going to walk in the door. Some people really find that a pro. If you're somebody who loves general medicine, there are not many options that you can think about that will give you a range of presentations. That could be general practice, but it could be maybe A&E, emergency medicine, it could be acute medicine, but general practice certainly has a huge range of medicine given the huge clientele base that you're looking after on a day-to-day basis. So if you love your medicine and you can't think that I'm not a born orthopedic surgeon, I'm not a born cardiologist, I'm not a born vascular surgeon, then maybe general practice is something to consider. Pro number three is continuity of care. And what do I mean by this? Now, you may see a patient on day one of a presentation. You may see them again at day 6 when things develop. You may see them again at a month's time when the situation is still going on. They may, in the meantime, be admitted to hospital, be seen by a specialist. You see them back after. You talk about treatment. You look at side effects. You may talk about interactions with other medications, other conditions that they may have. You may see that person for the next 3 years, 4 years, 10 years, 20 years. That is continuity of care. You can see the story develop, you can see the story from day one to day end, and all the decisions that are made in that period about that person's health have some input from the GP. Continuity of care is something that you very rarely see in modern medicine in other specialties. In other specialties, you may see somebody at a certain point of the journey. You may have certain inputs, follow them up for a little bit of time, and then refer back to the GP. But in general practice, you have that day one to day end review and that continuity of care, that ability to put in place something, see how it develops, change things around, try something new, get some feedback, look at some changes and problems that they're having, adapt the plan, take into account other things that may develop, new conditions, new medications that may be started, new doubts, new worries. That continuity of care is a definite pro of general practice. And sometimes the satisfaction that you get of seeing a story from the beginning through to the end is something that people always talk about as a huge pro when it comes to general practice. Continuity of care, if you do general practice, is something that you will understand very, very quickly. Pro number 4, choose your working time. Now, of course, you go through GP training, and that's a very scheduled, kind of formatted training program. But once you come out the other side, then you really can decide how much, how little, when, or where you do your work. And again, there's not many other specialties that allow you that degree of flexibility in terms of the way that you create your week. So, for example, some people may say, I only want to work mornings because I have things to do in the afternoon, I have other things that I want to get to, I have other things that I want to do in my life. So you may decide, I just want to do 5 mornings a week, Monday, Tuesday, Wednesday, Thursday, Friday. Some people may say, look, I want to just do 3 days in the week and then have 2 days completely free. So you may do Monday, Tuesday, Wednesday, you decide to do full days, but you decide to have Thursday and Friday off. Some people say, look, I don't really want to work in the week, I just want to work on weekends and as an out of hours GP. So they may pick up shifts on Saturdays and Sundays and keep the majority of their working week free. Some people may say, I want to do short sessions of 3 hours. Some people say, I want to do long sessions of 7 or 8 hours. Again, you can really create your working week. You can work as much or as little as you like in general practice, and that flexibility of working pattern and working style has very few matches when it comes to other routes in medicine in the UK. And not just you can decide the working hours, you can decide the type of work that you want to be, i.e. the type of GP that you want to be. You could be a locum GP where it's completely flexible and you pick up shifts whenever you feel like doing so. You could be a salaried GP where you're contracted to work certain days, certain hours in a practice. You could be a GP partner where you in essence own the business and think about how to shape that general practice and the health within the community. Again, there's so much flexibility in the way that you work and the amount that you work, and therefore the style that you work as well. And that has got to be seen as a huge pro for general practice. And the 5th pro that I want to focus on, there are lots of pros to focus on, but the 5th one that I want to focus on, because this really helped me in my own career in general practice, is that it gives you the ability or the time or the space to develop something else. Now that could be a clinical side string that you develop, or it could be a non-clinical thing as well. If it's a clinical, then of course you have the term GPSI, GPSI, GP with specialist interest. So you could be, for example, a GP for 2 days in the week and then have a specialist interest in dermatology or women's health or pediatrics, where you run clinics specifically in that area, you have further training in that area. So you have that flexibility to do something else on a clinical basis. So for example, if you've always had a passion for women's health or for doing colonoscopes or minor surgery, then you may be able to carve out a career where you can be a GP, that's your kind of primary role, but you have a secondary clinical role as well. And again, it adds to that flexibility of doing your week as you want to do it. So it gives you time to do other clinical work in other fields, but also it gives you time to do other non-clinical work as well. Again, you are creating your own week, so you may want to do work related to medical politics, medical education, medico-legal work, for example, and things outside of medicine. I don't know, entrepreneurship, building a business, property investment. But again, you get the flexibility to do other things alongside your clinical practice. Now, of course, in other specialties, if you're working in hospital as a consultant, you can, of course, develop other interests. But in general practice, you really do have that ability because you can create your own week and adapt that on a week-by-week basis if necessary. So another huge pro is the fact that it gives you space and time to do other things, whether clinical interests or non-clinical interests as well. So 5 super pros then all really relate to the first one, which is flexibility. One of this, like I said at the beginning, one of the main draws of general practice is flexibility to develop your life and career as you see fit. But of course, whenever there are pros, there are certain cons as well. And I'm going to go through a number of cons that people often come to me about when it comes to general practice. And admittedly, I'm looking at it from a slightly biased viewpoint because I've been through general practice and I kind of see them as pros, not cons. But just for the fairness of this video, let me go through some of the cons as well, so you can think about those if you're considering a career in general practice. Con number one that I often hear about is that you miss acute work in general practice. Maybe people think, well, you just see the same old chronic conditions coming in day out. There's no busyness, there's no acute medicine. That is not true. Sometimes in general practice, you see the most acute presentations. Remember, you have no idea what's going to walk in the door, and sometimes general practice is the first port of call for somebody who's very acutely, severely unwell. Someone might walk in with acute central chest pain. Someone might walk in doubled over with an acute abdomen. Someone might walk over having a stroke at that point. You need to know your acute medicine. Yes, you're going to see a lot of non-acute presentations, but in general practice, you can never afford to lose your ability to deal with things at that point of time. So if you think one of the main cons is that you don't deal with any acute medicine, that is wrong. If you are someone that really thrives in the acute environment dealing with these kind of things, then yes, there are other specialties that you will see more of that in. But don't think that in GP land you don't see any acute medicine, because you certainly do. The second con that I often hear about is loneliness. Now, some people, yes, in a career in general practice do feel that they miss that team environment, working on a ward, doing ward rounds together, seeing patients together. Yes, I appreciate that. If you're that type of doctor that you like that and you really thrive on that, then yes, you may feel when you're working in a clinic, in a room and seeing 18 to 20 patients, whatever it is in the morning or an afternoon on your own, that sense of loneliness may well be there. But the caveat to that is that modern day general practice is very different to general practice of 5 or 10 years ago. Now there are lots and lots of big multi-center general practices where there are lots of GPs working, and not just GPs, members of other healthcare professionals, whether it's nursing colleagues, pharmacy colleagues, ANP colleagues, for example, and you're working as a team. So often, for example, there are MDT or multidisciplinary team meetings that happen just like in hospital, where lots of doctors come together and talk about a patient in more detail. So that team environment is still there in modern day general practice, but I do see how some people may feel like it's a little bit lonely if you're sitting in one room seeing patient after patient on your own, even if it's just for that 3 or 4 hour period before you then go and mingle with other doctors. So yes, I can see that as a con, but also remember, the way general practice is changing, that is going to become less and less and less of a factor. Con number 3 that I often hear about is too much responsibility. And I do understand this. Sometimes, particularly when you're in GP training, for example, you may be in your own room seeing your patient come in, and there isn't that person to suddenly bounce off an idea or what do you think about this, for example. That level of responsibility can seem quite high. Now imagine that you're on a Friday evening and you're seeing a patient, the only one left in the practice, you're doing the evening, afternoon list, and someone comes in and you're not quite sure what to do. Should I admit them? Should I not? You take a decision not to admit that person to hospital. That is a lot of responsibility to take on your shoulders, and people do feel it. And if you're that kind of person that you know already that is not for you, then it's something to seriously consider, because you are going to get situations where you need to get used to dealing with uncertainty, for example. You need to get used to taking decisions based on little information. You don't have perhaps blood test results to hand. You don't have an x-ray to hand, for example, and that level of responsibility can feel overwhelming for certain people. So important to bear that in mind. Yes, it's a fantastic career. Yes, you develop your clinical acumen, your gut feeling, your instinct heavily by seeing patients in this type of situation. But yes, some people do say, I feel the level of responsibility on my own is a little bit too high, and therefore it's something that's worth bearing in mind as a potential con when it comes to general practice. The fourth con that I often hear about is that people get de-skilled in general practice. And I do get this. If you're somebody who loves your practical procedures, if you're doing chest drains all the time, ascitic taps all the time, of course you're not going to be doing that to that level, in fact, at all in general practice. But that doesn't mean that you get de-skilled. You build up skills in other areas, acute examination, finding out soft signs that can make a difference between admission and not admission, for example. And you can develop certain skills like minor surgery, or like we said earlier, as a GP with a specialist interest in something else and use those skills in another setting in your career. So yes, you may get de-skilled in certain things that only happen in the hospital setting. And if that's for you and you love that type of thing, then maybe general practice is not the thing to think about. But it doesn't mean that you completely de-skill as a doctor. In fact, there are other skills that you can only develop in general practice that are really, really important to have as a clinician as well. And the fifth con that I want to talk about that I always hear is that in general practice, all you see is coughs and colds all day long, coughs and colds all day long, coughs and colds. It is just not true. Of course, you are going to see a lot of what we would term worried well. So people coming in for checks, they probably know it's not really anything to worry about, but they just want to get a review, whether it's an infection in a child, for example, or sore throat or something like that. Yes, you may see certain presentations like that. But like I said earlier on, it is not the entirety of general practice. In fact, the skill to work out what's the difference between somebody coming in with another cough or cold and spotting something that actually needs a little bit of urgent action because there are signs there that tell you could be something a little bit more serious is a very important skill to have. So yes, I do see that you may see a lot of general presentations and you may not find that exciting as a clinician, but you're going to see a lot of pathology on the other side as well. And it's that balance that can make general practice a really good specialty to hone your overall skills as a clinician. So if you think that general practice is just about seeing coughs and colds day in, day out, then that is not true at all. So I really hope there's been of some value. Now I've covered some pros and I've covered some cons. And like I said at the beginning of the video, I'm a little bit biased perhaps because my career was general practice. I am a portfolio GP. I've been working for a GP for a long time. Now it's fully medical education. But my whole upbringing and background was a GP. My father was a GP. All I knew was general practice. And obviously I trained a lot of GP trainees to get through their exams as well. So if it's a little bit of a biased view, apologies. I've tried to put a bit of a balance out there, but I also wanted to counteract some of the cons that I often hear about general practice and just show you that sometimes perceptions are not exactly as they appear, and general practice does have a lot of benefits and pros and cons as well. One thing I would say though is that don't do general practice if you haven't looked into it, if you haven't considered it, if you don't really know what general practice is about. I see a lot of doctors apply for GP training not really knowing what GP training is all about, and then of course if you find that it's not really for you or not that style of medicine that you like or not the kind of setting that you want to work in, then it can cause problems down the line. So do some research, get a taste a week, find out a bit about general practice, sit in some clinics, understand what you're setting yourself for the next possibly 30, 40 years before you make that commitment. But if you are applying for GP training and you are a GP trainee and you are convinced that this is for you, there is so much available in this fantastic career of general practice. Now, if you are at the stage of preparing for GP application or you're preparing for the MSRA, for example, there are lots of resources and help that we can do, not just to get into GP training, but also once you're in GP training as well. And please always remember the coupon Arora Video 10, ARORAVIDEO10 will get you 10% off anything on the website, whether it's MSRA stuff, gold package, online course, audios, live course, flashcards, etc., or later on in training, MRC, GP, AKT, RCA, CSA, or whichever other exams you're preparing for in the future. But if you're sitting at one in this video thinking, is it general practice or is it something else? I really hope this video has been of some value to you. Any questions that you want, please do come at me. I'm more than happy to try and help you in those difficult decision processes that I know you need to make at this stage of your career. If you found this video of some value, please do subscribe to the channel, please do share, please do comment and put down below anything else that you'd like me to cover. On our YouTube channel, we do lots and lots of things for GP trainees, but also international medical graduate doctors, also medical students, all about careers and your next plans. So once again, if you found this video some value, please do subscribe. You know the hashtag Campus will pass, hashtag I went with Arora. Have a super day.